The traditional X-ray based DEXA, has many limitations. Like it's very susceptible to positioning changes, it's operator dependent. Also, the results vary between DEXA machines based on the life of the cathode ray tube. So, if the DEXA numbers could vary with such subtle changes, then the reproducibility is low and accuracy may also be of a concern. But in REMS Echolight, it has an automated internal quality checking software for every view. So that keeps accuracy and reproducibility high. Also, anecdotally, what we have seen is that the results are more consistent and reproducible between different facilities, which I think is pretty important if somebody is getting treatment for their bone health. The traditional DEXA imaging X ray beam travels from back to front in the lumbar spine. So it gets stopped by the denser posterior cortical bone before it can image the trabecular vertebral bodies in the front, which is where we need to check for bone density and quality. So that means that traditional X-ray DEXA may give somebody a false normal result, but all it did was look at the posterior elements. This is of concern, especially in patients with degenerative spine issues like bone spurs or those that have metallic hardware from surgery. But in REMS Echolight, we ultrasound the trabecular front part of the bone in the lumbar spine without going through the back posterior cortical bone. So that is more accurate. The built-in technology is also smart enough to cancel out the degenerative bone spurs and even metal, which is great even in the hips. So patients who have scoliosis or curved spine or patients who have a thin body habitus, they may also have errors with the traditional X-ray based DEXA exams. But in REMS, we can manually follow the curved spine so we can be more accurate with the results.